First half of my life, I spent in publishing. I was the editor of PC Magazine and a number of other publications. As you can see, Youthful Robin on the left side. I reviewed products. You gave me a product. I knew what to do with it. I reviewed it and I wrote about it. Fast forward, and that was me about a month ago, reviewing my latest batch of sleep products. So I say, I used to review products, now they review me. And I actually publish a series of articles that document my sleep, my heartbeat, my body fat. And I'd like to say, and I want you to think about this, because I thought about it really hard, and I think I really believe it, that we know more about our wellness today than sick people in an ICU unit knew 20 years ago in a hospital. For the first time ever, we know what a healthy person should be like. We know what we can aspire to. We know what we can manipulate. And that is sort of huge. And that gets me to talking about what I think the digital health conversation is going to evolve to be about, and that's longevity. And longevity is there's a dilemma involved here. I'm going to give you what I'm calling the longevity dilemma. Most of the things that we used to die from, we don't die from anymore. Car crashes, heart attacks, obesity. A lot of these things are no longer fatal. And I think Yaron just said it. Your dad can be 82 and said, be in my body for a minute and see what you feel like when those faculties start to go away. And I think that what's going to happen in the digital health era is that we are going to have a battle within ourselves between longevity, living forever, and we know we're not going to live forever, at least not yet, knowing when we've just sort of had enough. And I actually will go so far as to say, you can say you heard it here, that I think my generation will be the last generation that actually dies of natural causes. I think that there will be a generation who will say, hey, I've had enough, put it in my calendar, I'm ready to go next week. And it's going to be a very personal decision as much as any other part of your health on when you just say, okay, done with that. There's also, how many of you have read the Checklist Manifesto, Atul Gawande's book? So Atul Gawande says there's so much data out there and so many complications in the medical process today that a normal human person cannot possibly make an accurate diagnosis anymore. There's just too much information, and 95% of that information tends to be just noise. And if you look at the example, let's say you had a patient and you were monitoring them through telehealth and you were monitoring their heart rate. You don't want to know their heart rate continuously or their blood sugar continuously. You want to know the delta of change. When should I do something that's important? And we're not quite there yet. So we're still on doctors sifting through vast amounts of data, patients being incredibly frustrated, and no real good systems that are applying the AI or the algorithms, although we're starting to see them. On the patient side, I call this slide Socrates on steroids. And so, Socrates said, know thyself. We know ourselves, and if you use any of these monitors, you know yourself really, really well today. And you can actually manipulate everything from your emotional state to your brain state and your brain age, to smoking, to eating, to sleeping, to breathing, to fertility, and nutrition. And this is really unbelievable because you, as the patient, have this honor and this burden of taking control of your health. I call this, my mother would call me the nudge. I call this behavioral nudging. You will have all these things on you that will just zap you and say, you're not standing up straight, you ate too much today, you're not breathing while you speak, and those will be your signals. And you will, in fact, modify your behaviors, and they are learnable behaviors. And the most interesting thing about those behaviors is, in fact, by modifying, they say that 40% of outcomes in mortality are affected by behavioral norms. So if you can modify any one of these things, you can really save lives and make a difference. And you're starting to see that. On the flip side, and doctors tell me, in the early days of the internet, you'd go to the doctor's office with all your printouts from the web and you say, I think I have cancer. Well, now you go in with your Fitbits and your fuel bands and all of the data that you've collected on yourself, and the doctor goes, oh no, they're walking in with their body measurements. You're seeing a lot of, we know that the devices that are out there now are fairly primitive. They can track steps, but not if you're going uphill or downhill or how fast or at what altitude. We know that we have a graveyard of dead devices whose batteries don't last and who wear out pretty quickly. And we know that we're lacking some of the systems to make them available to everybody, and that's a reimbursement and a medical system that will actually encourage you to take care of yourself. So that's sort of the hardware, and we're at this hardware thing now, but I wanted to say, so we do this Digital Health Summit every year in Las Vegas. We do it in San Francisco in the summer. We've had some really smart people come and speak to us, and I'm particularly excited, as I think you should be, at what Genomics is doing now, and mostly that graph says it all. If you can't see it, it's the cost dropping from like $10,000 to $1,000, so that it's well within the realm of financial possibility to not just have your genes sequenced, but it's also something that, I don't know, who went to medical school? Ray, did you study genetics in school? Genetic sequencing? No, like it wasn't even part of the curriculum when people went to medical school. And now, if you look at, actually in Europe, the UK, for example, has just poured an enormous amount of money into sequencing the first 100,000 patients, and they want to be the first to make genetic screening a part of every medical checkup. And we're going to get there really quickly now that we've crossed this price chasm. I just had, and it's not just genes, so about 3 months ago, I had my blood taken from my body in the name of journalism, and I did a study of 34 of my biomarkers. Now, I go to the doctor every year. The doctor takes my blood. I've never had a report like this. It told me what was high, what was low, what I was eating, what I shouldn't eat. And I called my doctor. I said, hey, you know, I have like high iron levels. Like, do I have a problem? And he said, oh, I never noticed that. So I went in with my little piece of paper, and he was kind of annoyed at me for doing this. But in fact, a little change in diet and, you know, things that you think are healthy, like spinach and kale, you eliminate them and things change. So blood's been taken forever, but nobody's looked at it as a source of preventative medicine rather than just diagnostic medicine. And the other thing that I want you to think about is bionics. You can maybe not live forever, but not only can you live forever, but you can be better than you were. You can have knees that jump higher, eyes that see better, ears that hear better, and it's all there and available now. So you can actually replace all your worn parts and be a better person through bionic living. Last year, every year at CES, we do an event called Robots on the Runway. And when we did it last, we invited the Exo people. And Exo creates a exoskeleton. And in this case, a wounded warrior who was paralyzed wore it and used his brain to signal this device so that he could walk across the floor. And I have to tell you, there wasn't a dry eye in that whole room. It was the most amazing experience. And so we are looking at this age where bionics are really possible. And we're going to have to think about that. And finally, big data. You probably, if you went to anything at South by Southwest today, you heard about data. Data is growing so fast. I'm going to use, even though it's not a Philips thing, I'm going to talk about Watson for a minute, because basically IBM's Watson, they just feed it research all day. Case studies. I mean, they just feed it stuff. It's like a monster, right? They just feed it journals and case studies and medical records. And so Watson won Jeopardy, and now we have to figure out if Watson will win cancer as well. And the hardest part, and the challenge to Philips and to all of the other companies, is to really help us figure out how to get through the noise to the signal that we need to get. And we trust a lot in data right now, but it's sort of like what Yaron said about the EPIC system. You can sit there and be putting in data and miss the whole thing. And I don't care if it's digital health or driverless cars or ingestible pills or home security systems. This data, pretty soon they don't really need you. Like in the driverless car, you just sit there. The car camera is talking to the radar, is talking to the LiDAR, is talking to the cameras placed all around, is talking to the accelerometers. You're like out of the picture. They don't really need you to make these decisions. So we're going to really be questioning how much of our trust we put in data, and it all comes down to asking the right questions. Daniel Kraft gave our keynote at CES this year, and I just took this quote to leave you with, and he said, "The trick is to make this data actionable. Blend it with artificial intelligence, we're going to learn new things, and the consumer can triage themselves." And that's just one last thing. So crowds. We're talking about big data, the crowd getting involved. You heard about the Apple Research Kit last week. You know what Philips is doing. Everybody's getting in this idea of multiple people getting involved on voluntarily, whether it's altruistic or in their self-interest, parting with their personal health information. I urge you to watch what's going on and to see if we can't solve some problems. I'm pretty excited about it. And that's it. Poured through that.